Hey there, going live today to talk about what is functional neurologic disorder and how can it happen. I'm going live on this topic because of all of your great questions that you have sent me as we prepare for our functional neurologic disorders masterclass for people with FND, which is tomorrow, which is Thursday, February 22nd. And people sent such great questions. I was like, I've got to answer some of these now. And if you are a person or family member of somebody with FND and you're not already signed up for a masterclass, go sign up for it. It is live tomorrow. It's going to be myself, Chelsea, our FND program director, Ava, our movement disorder fellow, all talking about functional neurologic disorders and really we're going to do some tangible things together in the masterclass. I'm super excited for that. So go sign up. You can actually comment on this video and I'll send you the link. I don't know if I can do that while we're going live, but send me a DM. I'll send you a link. By the way, if we haven't met, my name is Julie Hirschberg. I'm a neurologic physical therapist. I am the owner and founder of re+active Therapy and Wellness. I'm in the Los Angeles area, and today we have sun. It's been really rainy here lately, and that's very unusual for LA. So I'm really excited to dive into this topic, and it used to be that I could actually share some pictures while I'm presenting, and I can't do that anymore in the live. So I put the pictures in the post this morning, so you can always go back to them. I'm a very visual person, so let's start. By the way, lots of great comments and questions already coming through. Mia, link, please. Mia, send me a direct message. I'll send you the link. Same with Sam, the cat lady. Hi, Sam, the cat lady. I love that. Yeah, send me a message. I'll send you the link so you can join us live tomorrow. Also, it's recorded. I will send out the recording to everybody who signed up once it's processed. Sometimes that takes a day to get uploaded, but I'll send it out to everybody as well. So, and I'll try to get to all y'all's questions. And if I don't, we've got a masterclass tomorrow and I'll get some more questions. So the first question is, what really is functional neurologic disorder? And one of my favorite definitions comes from an article from 2022, Mark Hallett and colleagues. They define functional neurologic disorder, and I'm going to read it. A condition in which the primary pathophysiologic processes are alterations in functioning of brain networks. So there's a couple of things in that definition that are really important. So one is this network model of the brain, and I even brought my little brain model here. Traditionally, the brain has really been thought of as concrete structures or anatomical locations, right? We got the cerebellum, we got the brainstem, we've got the temporal lobe, we got the frontal lobe. But in reality, the way the brain really works is networks, meaning different areas of the brain all connecting and talking to each other, a lot of back and forth. And then of course, this is all, if we keep coming down here into our spinal cord, this is all connected to our body. So our body always sending information back through our sensory systems to the brain, to these networks for interpretation. Because the brain is set up in this network fashion, and because it is plastic, not meaning literal plastic like my particular brain here, but that it can change, it actually makes sense that the networks can go awry. Connections can change, they can shift, they can misfire, and even miswire, so to speak, if you think of neurons connecting to each other as wires. It makes sense that a functional neurologic disorder could occur. And in fact, a life Without these occurring, probably wouldn't happen in a brain that can constantly change and learn and make new connections. So the primary pathophysiologic, meaning what is causing the pathology, is alterations in functioning of the brain networks. Now, it turns out that we even know some of the networks that are involved. So actually, I'll keep little brain up. One of the key areas and its connections to others is the right side of the brain, temporal, so this is the temporal lobe, parietal junction. So the junction here on the right side has been shown multiple times in studies to be implicated in functional neurologic disorders. Now, not that there's a stroke here or a lesion here, but the connections to other areas of the brain seem to be off, miswiring. And this particular area of the brain is the part that compares information, so feedback from the body, to what we might output. And so it has some sort of comparison function, and it provides the sense that we have control over our movements and behaviors. So you can imagine if there is some misfiring or miswiring in this part of the brain, that a person may not have control over their movements, functions, sensations, cognitions and thoughts, etc. So, and that is just one of the networks that has been implicated in imaging studies in functional neurologic disorders. By the way, most of these are done in functional MRI, meaning it's magnetic resonance imaging, not a static image, but it's an image that's taken as a person is doing a task. That's how we can look at the network capabilities of the brain. So that's the number one thing. It's a connection issue. It's also very common. So, but I'll tell you, as a clinician myself, it's not something that I had even heard about 12 years ago. This was a newer term. So if you feel like, gosh, it feels like it's the rare disease and nobody understands it, it's because we didn't understand it and we're just now understanding it. And we might have learned other terms like conversion disorder and things like that. Now, I did a discussion just like a week ago talking about the diagnosis. How is it diagnosed, and that it's a positive diagnosis. So go catch that video too if you're like, how is this diagnosed? But another piece that's really important in functional neurologic disorders is that it's not one thing. There are many versions, I would say, or subtypes of a functional neurologic disorder. The most common that I see is a functional movement disorder. The second most common that I see is functional seizures. Functional movement disorder would be anything that's a functional neurologic disorder that affects movement, and it includes functional dystonia, functional myoclonus, functional tremors, all really more common types of functional neurologic disorders. Other things that can fit under this umbrella term are things like functional dizziness. 3PD is a type of functional dizziness. 3PD stands for persistent perceptual postural dizziness. Other things that might fit under that umbrella too are things like CRPS, complex regional pain syndrome, and persistent post-concussion symptoms. So it's a wide umbrella. You can imagine why this might be difficult to study because those presentations are quite different from one another. So a lot of the studies in functional neurologic disorders actually might focus on a subtype or subgroup of people with the disorder. Now, just like when we have to say what it is, we have to say what it's not. So in one of the slides that I shared in the post today, I go through very clearly what it is not. And the number one thing that, it's like nails on a chalkboard to me, is when somebody says, I think they're just faking it. I think they're making this up. Research shows time and time again that FND is not faking, it's not malingering. And unfortunately, there are some folks that still think that's the case. And that's not the case in functional neurologic disorder. The other misconception is that it is entirely psychological. That's where the term conversion comes from. It's kind of a Freudian term, that a person's trauma or emotional trauma converted to a physical symptom. Now, I think it's important to know that for some folks, there is, in some of the literature, actually a trauma subtype of functional neurologic disorder. And I want to be really sensitive to that, where it could be, I don't want to say entirely, but maybe primarily a psychosocial onset. And in fact, the cases that I've seen, the patient has come and said, I know exactly what trauma caused this. And so it's usually not the person that's like, look, I don't think it's psychological. I don't know what happened here. That person is very likely not that trauma onset. So that is a subgroup of functional neurologic disorders. That is not everybody. And what we see instead is that it is a complex interaction. So we're going to talk about how might it happen. Most of the time, it's not a purely psychological issue, but that can be the case. But a lot of the times, it's a complex interaction of things. And I'll talk about that in a second. The other thing, and I talked about this last week in the diagnosis, functional neurologic disorder is not a wastebasket diagnosis of exclusion, meaning we can't figure it out, so let's throw it in the basket of FND. That is not how it should be diagnosed. Sometimes it happens that way. Should not be diagnosed. There are positive clinical signs. And somebody asked here, can you talk about the Hoover sign and what it means? I feel like I should do a whole video just on the Hoover sign and the research that shows the sensitivity and specificity for functional neurologic disorders. So to be continued, but the Hoover sign is one of those clinical signs, positive signs that we see with functional weakness. Now, it really is specific to a person who has a one-sided hemiparetic functional weakness. That's what the test was designed for. And a positive Hoover sign would indicate the presence of functional weakness. To be continued on a whole video about that. Thank you for the great question. But that's one of the positive signs. I'm going to just, Hoover sign, what does it mean? So again, the Hoover sign is one of the positive signs for functional weakness, and it actually deals with a person testing one limb for strength, testing the other limb, and looking at the effect of testing the opposite limb, the effect on that person's ability to hold strength in the more involved limb. I know that's a lot of words. I want to demonstrate it for you, but I need another person. And my dog's not going to hack it right now. So we'll come back to Hoover sign, but thank you for that question. I might even make a little note to myself here, if you don't mind, because I love all your questions and sometimes my memory fails me. I'm going to do something on the Hoover sign. Somebody else says they're dealing with cervical dystonia and CRPS. Makes me super excited for tomorrow and to hear what you have to say. Great. I'm so glad. Somebody else, dystonia. Start with dystonia. Yeah, so dystonia, actually, functional tremor is the most common functional movement disorder, but dystonia is up there as well. AJ says, love your presentation at CSM. Thank you so much for coming. We presented at a professional conference last week in Boston. I so enjoyed it. We had a packed room of people who cared about FND. So y'all, the future is bright. Somebody else commented that why are all the treatment centers on the West Coast? Where are they on the East Coast? This is part of my mission. We should have more people like Reactive, frankly, that are passionate about FND and want to help people. And we're looking to keep growing that. Yes. And I was going to say, we know some great therapists on the East Coast, in Boston, in New York City. Absolutely. And again, if you're looking for the link for our masterclass, which is tomorrow, please send me a DM. You can also comment on the post from earlier today. If you comment F&D on that post, I've set it up so I can send you the link. So please do that. Okay. Let's see. We've got folks sharing here as well. My right side is the side that I have trouble. So if you have weakness on one side, it may be that a positive Hoover sign would be helpful for you. And hi, Becky Handler here says such a wealth of knowledge, a way of making it all make sense. Thank you. That is actually what I love to do. So somebody else is asking, before I dive into this next part of how this would happen, would an fMRI benefit a person with FND? So fMRI is something that's done in a research study. Again, this is functional magnetic resonance imaging. It's not just done in FND, it's done in a lot of disorders and for research only. It does not give a diagnostic sign. So at this point, it would not be beneficial for a person with FND. But it sure would be nice to have something like that. Yeah, this person is saying these symptoms don't feel made up. They absolutely are not made up. You're absolutely right. If you talk to anybody with FND, they're like, I wish I could make these up, but these symptoms are controlling my life and I don't have control over them. Absolutely. It is absolutely not made up. Somebody else in Boston saw my talk. Oh my gosh, yay. So great. So great. Okay, so I'm just looking to see, great. And somebody else, I'd love to pursue a neuropsych degree to be part of the solution. Yes, join the club, be a part of the solution. So let's talk about the next piece. So again, I put these visuals in the post earlier today, talking about what is FND, what's the definition, how common it is, what are the subtypes. Let's talk about how this might happen. So if you look at those, again, you would go back to the post that I put in this morning. I created a visual of how this could occur. And this is based on the literature. In fact, you'll see like 10 different, I'm looking down at it. It's about 10 different references that we pulled in to really try to put all of the pieces of the pathophysiology and the neuroscience into one. So first, I have to tell you, functional neurologic disorders are not that different from other neurologic disorders. ALS, MS, Parkinson's disease, for example, Guillain-Barré syndrome, some of the polyneuropathies, we don't fully understand the cause, what caused them. And in fact, in a lot of these, it's multifactorial. Maybe there was an environmental issue, maybe a viral trigger, maybe there's a genetic piece, maybe it's all three in one. And in functional neurologic disorders, not that different. We don't fully understand. And people are actively trying to figure this out. So when I talk about these, I'm bringing in the pieces of the science that we do know, but I wish I could tell you, boom, it's this, there's this genetic thing, boom, it's this brain factor, but it's not, that hasn't come out that simply. But to be honest, that very rarely happens in neuro. It's one of the reasons I love neuro, because it sparks the curiosity in me, but it's not a black and white thing. The brain just isn't. So let's talk about what we know. Very often, a person with a functional neurologic disorder has some sort of start to their symptom, right? And that can occur after an injury. So that can occur after a broken foot, after a surgery. It could happen, and I got many questions about this for our masterclass. It could happen after a virus. It could happen after a vaccine, any vaccine. It could happen with a neurologic disorder. So, for example, multiple sclerosis, for example, Parkinson's disease. So it can happen with one event Although more often what we see is actually an accumulation of events. So it may have appeared that one virus was the issue, but actually it turns out that person had that virus. Before that virus, they had some sort of genetic predisposition. They actually had hypermobility syndrome and autism and ADHD and 3 nights of sleep deprivation. And they actually have a mast cell activation syndrome, so that ups their allergic activity for in response to many different pieces. If you didn't know what mast cell activation syndrome was, so it turns out actually an accumulation of multiple factors for one person. For another person, they just had surgery on their foot with nothing else beforehand. For another person, it was a series of concussions, which would clearly make brain connection changes, right? For another person, it just seemed to come out of nowhere. For another person, their grandma died. For another person, I saw somebody ask about POTS. For another person, they were having frequent, really severe, maybe drop attacks or tachycardia because of POTS. Now, POTS, postural orthostatic tachycardic syndrome, it's not a functional neurologic disorder. It is something that we see as comorbid, as coexisting with a functional neurologic disorder. And it could have actually been like a precipitating event. It would make sense because the autonomic nervous system might trigger some brain changes. So what I am saying here is that there's not one way this occurs. So we see this initial event, or we see an accumulation of pieces and multiple factors involved. And I will tell you, sometimes we don't get to the bottom of what exactly that was. And that's also okay. Same for people with MS or ALS or Parkinson's disease or Guillain-Barré and many other neurologic disorders. We just don't quite get to the bottom of how it occurs. It doesn't mean we can't figure out how to get better. So I don't want it to seem like just because we can't figure out exactly what caused it, doesn't mean we can't get to the bottom of what's happening right now and help a person get better. So what happens after an event or an accumulation of events? Typically, brain-wise, nervous system-wise, we have adaptations to that, right? And some folks fracture their ankle, they adapt and recover, and they never have a functional neurologic disorder. But somebody else may. And why is that? So what are the factors for that person that caused brain changes? Again, we don't always know, but some of the pieces of the literature kind of put into several buckets of things that might really promote positive brain changes after an event or an accumulation of events. And then there are things that actually can contribute, I would say, negatively to brain changes or cause the brain to kind of run amok or run awry or we've been using the term refire, rewire really inappropriately after an injury. It happens. It's not your fault, okay? So that's one of the things that I think is so important. You didn't do this. You didn't make your brain do this. Some decision that you made didn't cause this, okay? This occurred. There might have been factors, most of them completely out of your control. So some of the things that really promote very positive brain changes are not having genetic diseases, not having autoimmune dysfunction, not having a comorbid neurologic disorder, right? So these things like set up the brain for really great changes. There's lifestyle factors. So the amount of blood flow to your brain that comes through your physical activity. A person with orthostatic hypotension or dysautonomia or POTS might not be able to control that so well. So they're not getting great blood flow to their brain. There might be sleep factors. That's part of our lifestyle management. It might be how our body is responding to stress, some of which is genetically mediated. But again, not a blame of like, hey, you're not managing stress well. This is maybe how our brain and body are wired. And that can lead to neuroplastic changes in the brain. Some of the things that can contribute kind of to this negative neuroplasticity are all of the pieces that we talked. There's genetic factors, there's immune factors, your inflammatory response, maybe actually having changes or differences in how you process sensory information. Maybe there's some inaccuracies there. Maybe you've been sleep deprived, maybe deconditioned. Maybe there were psychosocial pieces, a high amount of fear. Maybe you've been isolated, a high sympathetic or fight or flight drive. All of those contribute to how our brain responds to an injury or an accumulation of things. Now, luckily, some of those are things that are modifiable, that we can change. Can't change your genes, but actually we know now through some pieces we can maybe change how genes are expressed. And here's the thing. So let's say you have this initial event or accumulation of events. We have adaptation in the brain and the nervous system. Our brain and body adapts and changes. And functional neurologic disorder occurs. So this is where our brain plasticity has gone awry. We lose our sense of self-agency and control over our movements or other sensations. We might have actual changes in the cortical map of our brain, maybe in our sensory system. And we get symptoms. We get involuntary movements, we get tics, we get twitches, we get dystonia, we get pain, we get weakness, we get changes in sensation. If you look at the picture, that's functional neurologic disorder. The good news is that through rehabilitation, through different types of therapy like physical therapy, occupational therapy, speech therapy, psychology, we can restore or reconnect or change that wiring. So again, I wish I had that visual with me because I keep doing this because the first one's like a circle, then we've got squares, and then we have these like little diamonds. But the process of rehab is changing the brain, rewiring it. I wish, honestly, somebody asked about fMRI. I wish we could like actively do fMRI every time we're doing therapy, because every time I'm in physical therapy, I am imagining like bing, 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 like in the brain, like things are changing. But I don't know that for sure, right? Like I'm not able to just open somebody up and be like, yeah, I see it. I wish I could, but that's what I imagine happening. And when I see a person's capabilities change, I see it happening on the outside, but I can't honestly say I know for sure what's happening on the inside. But that is what we know, at least for now, about how this might happen. I see some, I'm going to get to questions here. So getting my blood checked. So yes, are there pieces that are systemic in your system that might be contributing to this? I will say the only, a couple of things have come up when it comes in the literature for FND. There's not a blood test for FND, but there's a couple of things that maybe have been correlated. One is, and actually I think this is, I don't have the reference on me. I think it's serum cortisol, but I'm not totally sure that is the right test. But some folks with FND may have a higher level of cortisol coming from that fight or flight or stress response. That could also be genetic. I was thinking of one other blood test, and I'm drawing a blank. But there's not a blood test for FND, but it may be part of another comorbid condition that is making it difficult to make brain changes. So I think that is, there's so much to explore there. Somebody else is asking more about the salience network. So I'm going to have to do another talk about the salience network and some of these brain networks. So this is clearly a PT. Because who else throws out the word salience network? I just love you already, so thank you. And the salience network is one of the key networks in the brain that we think may sometimes actually be kind of turned down in functional neurologic disorders, or not filtering information optimally. So to be continued on the salience network for sure. Somebody else asked, oh, can you send me the link for tomorrow? So Cindy is asking that. Cindy sent me a message or comment on the post earlier today. I'll send the link. Oh, somebody else says I have severe migraines. Thank you. So I actually put the reference on the visual in the post earlier today. Migraine is one of the most common comorbid conditions in functional neurologic disorders. It is not a functional neurologic disorder, but it is a brain connection issue. It just has a particular, I want to say, stamp on the brain, and has a different pathophysiology. The pathophysiology of migraine is actually really interesting and involves multiple centers of the brain as well as the peripheral nerves. But when it comes to brain changes, it makes a lot of sense that a person with migraine might also develop functional neurologic disorder because of this constant changing and heightening of the nervous system in a migraine state and outside of a migraine state. And stroke-like migraine. Thank you for sharing that. So there are migraines that look like hemiplegia, and meaning like a one-sided weakness, and can completely present like you've had a stroke. What can go awry in a functional neurologic disorder is, in the right brain kind of setting, the brain actually learns that as a new movement pattern. And even if the migraine's not occurring, that movement pattern is occurring, and it sustains. Not because a person is trying to do that or faking it, but the brain has learned it. Because the brain is like super smart and super fast and trying to be efficient and trying to be helpful, but that's not helpful to sustain that. That is why, to me, it actually really makes sense that migraine and FND can go hand in hand. Really helpful to get migraine symptoms managed. And I will say migraine and FND treatment can like really go so nicely together. PT, OT, psychology, yoga therapy, all really helpful. Somebody else is asking, can individuals with FND have relapses after a period of improvement, and what causes this? Brilliant question. I got this sent to me multiple times as well for our masterclass tomorrow. We'll talk about it a little bit there as well, but let's talk briefly about it because it's a great question. So yes, people with FND can have relapses. Not everybody does. And again, much like other neurologic disorders that may have relapses and remissions, like multiple sclerosis, for example, some people have an episode in MS and never have an episode again. That also can happen in FND. So that's not unusual. And what we find, because we see a lot of people with functional neurologic disorders, we see people with MS, we see the full spectrum of how often they might have a flare of symptoms, and also how often they might recover from those. What we see predominantly in people with FND is that they might have a flare of symptoms. Could be really small, could be really big. One of the most important pieces in a person with FND is understanding what their nervous system needs. For example, my nervous system needs to move. I don't know if you see, but I am constantly moving when I'm talking to you, and I'm very sorry if it's really distracting visually, because it might be, because I like to move, and I actually have a treadmill over here. If I could talk to you and be on the treadmill, I would, because I'd be more regulated. So, but I think it's really like visually distracting, so I don't. But that's what my nervous system needs. And if I was a person with functional neurologic disorder, I would actually build up my days, my months, my years around things that I know are helpful for my nervous system. Movement, sensations, autonomic pieces, lifestyle pieces, motor control pieces, psychological pieces. I would set up my day. And honestly, I do this already. I have an autoimmune disorder. I have rheumatoid arthritis. And I have to do certain things to ensure that I don't, that's another disorder. Autoimmune disorders relapse and remit, and they can be unpredictable. But for everybody, it's different, right? So this person asks, what causes this? You have to learn that for yourself. Now, I'm not saying like, don't ask for help. Like, oh my gosh, physical therapy, OT, psychology, all of those things can help you so much in figuring that out, but there's not one cause. Now, I will say some of the more frequently overlooked areas are sensory and autonomic. Now, I say this as I'm literally using my brand new fidget. Look at these little magnetic balls. I just love them. But I have found this helps me not move as much while I'm talking, but it's very regulating. This is sensory for me. This is a sensory input. I hope you all have fidgets as well. What a great question. Another question here. Do you know anything about the neurologic basis for neurodevelopmental conditions like schizophrenia? Could that be a risk factor for FND? What a brilliant question. This is not an area that I have dove into deeply. So stay tuned, because I think there are some interesting pieces here. So things that I have dived into a little more deeply are autism, ADHD, and those have more recently just come out as potential pre-existing. We don't know that it caused FND, but pre-existing or comorbid conditions in functional neurologic disorders. There are many overlaps with schizophrenia and other movement disorders. So that wouldn't be surprising to me. I don't know that that has been shown to be a risk factor. Great question. Oh, great question from my friend, my PT friend from CSM. Have you noticed an increase in cases of FND due to COVID? So this was another question that some people asked for the masterclass for tomorrow. And again, if I can't get to y'all's questions tonight, please come to the masterclass tomorrow or catch the recording. And let's keep chatting about this. But you send me questions and I do a live video, so we'll keep doing this. Now, I have not personally noticed that there's an increase in cases of FND due to COVID. There are new neurologic disorders due to COVID. And we have a whole long COVID program at Reactive. It's not a functional neurologic disorder. So that is important. Somebody could have long COVID and a functional neurologic disorder, but long COVID itself and the symptoms that we see are not a functional neurologic disorder. But with that being said, what many people have asked me about is, I got this after a vaccine. Or I got this after I got COVID. Have we seen that clinically? Yes. Has the research showed that? Yes. Now, what we don't know, we know that people with mast cell activation syndrome can have really heightened inflammatory responses to a vaccine. Could a mast cell activation be one of the underlying pieces after a vaccine? Possibly. That hasn't been done, right? So I think that would be something really important to look at as a potential contributing factor. When we think of psychosocial factors with COVID, I think about this a lot because when I got COVID, it was devastating because I couldn't be around people. I got it like the day I was leaving to go camping with my family, my extended family, and we had to like sit apart. It was awful. And when we think of how that isolation and depression affect the brain, absolutely could be a contributing factor. But we don't know a lot here. There's also a lot of other neurologic issues that have come up as manifestations after a COVID infection. So really great question. Great question about low cortisol. I haven't seen that come up, or low serotonin. I haven't seen that come up either. But boy, couldn't we all do a bunch of research studies? Somebody fund us, please. Oh my gosh, can we please connect? I have a very severe patient with FND relying heavily on my help. I love to chat briefly. Yes, so I'm going to tell my fellow clinicians here, I would love to chat with all of you about all of your cases. And I actually, it like truly is my passion. Send me things. I can sometimes get back to you. Sometimes I'll do a video like this, but the best way to be learning and doing and mentoring in FND is to join our Brain Bites group. Our Brain Bites group is an online learning and mentoring group for clinicians, PT, OT, speech, psychology, other professionals, and we talk about this all of the time, and we have an online community where people send cases and our entire team chimes in, and so do all of the other experts from all over the world. So if that is you, and particularly if you're being relied heavily on, which is a very big impact for you as a physical therapist, or OT, or wherever you are, you need a community. You absolutely do, because you can't do this alone. So come join Brain Bites. We open up this spring. But in the meantime, you can send me your case. Samantha, hi. Also, dysautonomia, such a common, so we often see dysautonomia is not a functional neurologic disorder. We often see them coexist because dysautonomia changes the brain. And so, Denise, I'm going to answer this question, and boy, I feel like we're going to go all night. I'm going to try to get to all y'all's questions, but if I don't, join us tomorrow for the masterclass. So, what a great question here. How does the sympathetic and parasympathetic systems relate to functional neurologic disorders? Brilliant question. And I feel like I should do a whole session just on this. But in short, what we understand in the research in functional neurologic disorders, most of this research, by the way, is in kiddos, but I believe one study in adults looks at changes in the autonomic nervous system in people with functional neurologic disorder. And there's a couple of ways that we can see those changes. One of the ways that we can measure it is through heart rate variability. And when the heart rate variability is very low, it is a sign of imbalance in the autonomic nervous system. And the balancing pieces in the autonomic nervous system are the sympathetic and parasympathetic. What you might hear is kind of fight or flight, sympathetic, rest and digest, parasympathetic. And if they're out of balance, we can actually get a lot of different symptoms produced by our nervous system. We don't really have control of them. And what we can see are things like tremor. We can see twitches in the body. And we don't always know that one of those is sympathetic or parasympathetic. It's one or the other, and we have to figure that out. We measure it through things like heart rate variability. But overall, what we find is if the nervous system is really out of balance, or we might say dysregulated, the person is going to have more symptoms, no matter what kind of symptoms they are. Seizures is a big one. And so we need to find the just right balance of their regulation. Not way up here, not way down here, but right in the middle. So that's why, you might hear things like vagus nerve activities. I don't use that phrase a lot because there's a lot of other parts of our autonomic nervous system. Call me an anatomy nerd, but the vagus nerve is huge and it's so important, but it's just not the only part. And it's not all about, like, not every person with FND is just like all super ramped up and overly sympathetic drive. We see the other thing as well. So we can't just like all breathe and do yoga and be like healed, right? So that is kind of a misconception in FND that we just need to like, improve our parasympathetic activation. For some people, absolutely. Actually, most of the world probably could use a little bit. But that's not the only thing. It's the balance. It's finding kind of the middle of the curve. Not here, not here. What a great question. You can see I could go on and on. Samantha says, this happened to me when I was diagnosed with COVID. I've taken a giant step back and super upset about it. I just want to say, of course you would, right? And I'm going to be like many people when they have gotten an infection or a virus that really depletes their system, they take a step back. They do. I did with my own autoimmune disorder, and it was really hard to get back to activities. I had to build it back up. And this is where I think you understanding your brain and body goes a long way. Because yes, you might take that step back. Many of us do. But you go, you know what? I've taken a step back before and I've gotten back. I know what my body and brain needs. I know I'm going to need more fidgets. I know that I'm going to need more sleep. I know that I'm going to need to change the sensory input for my activities. I know that I'm going to need more autonomic regulation. Now, I will say, by the way, if you're kind of like, I'm not sure what I need, come to our masterclass, because that's really what we're going to talk about, is how do you figure out what your body needs? And how can you take that information to your healthcare providers to help you figure it out? Because sometimes you can't figure it out on your own. I have a patient that reports feeling floaty constantly. So when somebody says they're floaty, I often think of the sensory system, because that's a sensation. That's a perception. Is that a vestibular issue? Is it a somatosensation? Is it a proprioception issue? I will look at those and assess those pieces and see if I can figure that out with them. Floaty is a common term that I will hear people say, maybe even disconnected from their body. Above average Joe, hello. How many patients have you seen go from having trouble walking and controlling their sympathetic and parasympathetic nervous system to having their life back and be able to work? I've seen so many people get back to walking, get back to moving, get back to caring for their kids, get back to work, get back to school. That's a big one for people. Schools are so overwhelming sensory-wise to our nervous system. So I could even give you the numbers probably on that, because we collect outcome data on all of the people that we see in our program. And I will tell you, one person was even here on the live. She's back to work. Now, does it mean they have zero symptoms? Does it mean they don't have to keep tending to their nervous system and understanding it? No. Some people might have zero symptoms, but I think like all of us as humans, like we need to learn about our brain and body, and we need to take care of it. That is a human thing. Really, really great comment here. I didn't develop my FND all at once, but rather it started with PNES, so functional seizures, and progressed to more disturbances in vocal, gait, weakness, and other movements over 3 years after COVID. Is that common? So I will tell you, there is this really great study that kind of shows a trajectory of what is typical in FND, which there's not like one type. But what I will tell you is that, yes, we can see that for some people, it might start with one symptom and then another one and then another one and then another one until they're kind of ramping up here until they're here with fluctuations. And then they get rehab. then they get the resources, then they learn about their brain and body and what it needs, and then maybe the seizures stop. Maybe the vocal changes decrease. Maybe the gait improves. Maybe the weakness improves. I'm not saying it's always in that order, but you are not alone in that trajectory. And I really think, having heard from you before, that you will continue to find things that your brain and body needs, and give you control of those symptoms. Somebody else wants my fidget. Isn't it beautiful? It's called Specs. I just ordered them. And my psychologist used to have these wonderful fidgets in her office. And then we've been on COVID. And when I'm in psychology, I literally my own therapy appointments, I'm nervous and I need sensory info to help me regulate. So Specs, SPEKS, not associated with it, just love it. Becky shares, my daughter was unable to walk and went to reactive for 9 weeks and now is back to walking like she used to. She left reactive knowing exactly what her body needs. Oh, my whole heart right there. Somebody else sharing that they gradually came on. Sarah sharing she loves working with kids on the spectrum. I do as well, kids and adults. Yeah, so very interesting. Somebody else is saying, I've noticed with my patient when she spoke about a very emotional topic, her posturing and movements were calm. This is counterintuitive to what I would expect with the sympathetic nervous system. You know what? I never expect one way. I got to tell you, I'm so glad you shared that because I actually think it's a misnomer that people think, oh, I'm emotional, I'm going to have more symptoms. No, it doesn't have to be that way. And that is the unique wiring for that person, right? So I can't say exactly why that is for that person, but I'd be figuring it out with them. And I think one of the things that kind of tells me is that I might want to look at their interoceptive ability and how they're sensing things in their body. But I'm so glad you said that because you know what? Don't ever there's not one way, right? And just because someone's having emotions doesn't mean they're going to have more symptoms. They could have less. They could have none. It could be worse, right? And I do see a lot of people that, even like myself, I'm super excited when I'm talking to y'all. I might have more symptoms just from being excited. It doesn't mean I'm completely dysregulated. It could be that I'm excited, and that's the way my brain is wired. Oh, somebody else is asking, could someone with FND and functional seizures have a baby safely? Absolutely. Seen it? Yes. Have we seen studies regarding the benefits of CBD, THC? Oh, somebody else asked me this at CSM, or psilocybin effects on FND. People are studying this. So to be continued. Right now, the studies in psilocybin are just that, studies, and they're with a psychologist to guide them, because one of the biggest things with both CBD, THC, and psilocybin is that there could be psychotic effects. And that is absolutely not what I would recommend for a person with FND. So doing it in a study under the supervision of a psychologist versus just experimenting with some magic mushrooms. That's going to be my professional opinion there. But the studies are coming. They absolutely are. They reported on them at the FND Society. So they are underway. Oh, how do you join that group? I think you're talking about Brain Bites. This is my favorite thing for clinicians. You can go to reactiveeducation.com/brainbites, get yourself on the wait list. You'll get in early when we open our doors, but we only open our doors twice a year. So we'll be coming. If you're a clinician, get on that wait list. Ooh, have you seen any cases of FND with central nervous system vasculitis? Because I feel like my FND makes my vasculitis worse. Yes, you are not alone. I have to tell you, this is Baby Dreamer 562. You are not alone, not just with vasculitis, but any other neurologic disorder. If you have a neurologic disorder that is already causing brain changes, it makes sense that some things might misfire or miswire as a result, and you might get a functional neurologic disorder as well, and that your functional neurologic disorder might actually make your other neurologic disorder worse, and vice versa. You are absolutely not alone. I don't think that I have had a patient with vasculitis per se, but every other neurologic disorder, absolutely. Stroke, MS, spinal cord injury, Parkinson's. In fact, I think Parkinson's and MS show up the most in the literature. So you are not alone. Great. Let me see. I think we have time for just a couple more questions. Oh, Fukuda step test. Thoughts on regards to dizziness, balance, tremor. So I'm not a one test kind of girl. The Fukuda step test is a test that we typically use in vestibular rehabilitation to test for somebody's orientation when their eyes are closed. There is something that I think is under tested in functional neurologic disorders as part of the sensory system is our ability to perceive where we are in space, and the Fukuda step test could help with that. That has not been studied in FND, but what a great question. Okay, here's a question. Is it more common to develop worse FND over time versus someone that develops it all at once? I don't think I know the answer to that. I don't know if it's been studied. I haven't seen that it's more common one way or the other. I think most of the people I have personally seen clinically kind of develop over time. But now you got me wondering. Protocol that may be helpful when addressing physical activity for someone with mitochondrial complex 4 deficiency. There's not a protocol. Even though I have done a lot of clinical research, I'm also not a protocol girl. Protocols are helpful for research. Protocols are hard to apply to the individual person in front of you. So I think when I think of graded exercise and physical activity and mitochondrial disorders, for example, I really am thinking, what is the person capable of right now? What is their system capable of? So really doing kind of baseline testing. And then for some folks, we're just not going to be able to push it. And for some mitochondrial disorders, that might be the case. For some muscular disorders, that might be the case. Or we are going super snail's pace to see if there is some capacity for improvement without overtaxing the system. But I don't know of a particular protocol. But you got me thinking. Now y'all are asking me questions I don't know the answer to. Question. How about the CNS vasculitis and the FND going back to walking normal? And again, I don't know that I've personally seen that combo, but I've seen a lot of people improve. I will tell you that. Great question. I'm sorry, I'm like so far behind your questions here. Stellate ganglion block and FND. Oh, okay. What a great question. I have not seen that in FND, but stellate ganglion is one of the ganglions in our sympathetic nervous system. Can be helpful for some disorders. Haven't seen it in FND, but gosh, it's possible that it's out there and I haven't seen it. Diagnosed with functional seizures and a lot of pain from issues with autoimmune disease and chronic back pain, end up being hospitalized. Waiting to see if there's nerve damage when diagnosed with functional seizures. So again, often things coexist, right? And often one can trigger the other. And it's important to understand what your brain and body needs. And this person says, thanks for answering my question. I feel better and more informed. I got to tell you, I think better and more informed is like half the battle. I feel that way when I learn things. Super snail's pace. Absolutely. Don't be afraid to go super snail's pace for folks that can't tolerate activity. I don't mind going super slow if that's the case. Oh, great question. Where do I find more information about the subset of F&D that comes from trauma? So there is a study, I don't know it off the top of my head, but I will maybe need to do another live. I'm writing all these notes down because we got Hoover sign, we got the trauma subtype. I believe that is actually in the title of the study. The trauma subtype of functional neurologic disorders. Take a look, see if you find it, but otherwise I'll put it on my list of things to chat about. But we are live tomorrow, F&D Masterclass. This is for people with F&D, but I've heard from a lot of clinicians, they're like, can I come? Of course you can come, of course, and share it with people with F&D. We're really trying to empower people with F&D to have the information to take and to their own practitioners, to take home, to use it themselves, to explore, to get curious about their brain and body. So, I think we just spent an hour. And I just want to thank you so much for asking really great questions. I learned so much from you. Really, you kind of keep me going and inspired to keep learning and growing more. So thank you. Thank you so much. I'm going to answer these last two. The question was, have you seen people go back to demanding jobs when symptom-free? I used to be in charge of events departments within hotels and miss it so much. And see, I want to tell you, I have seen people go back to demanding jobs, healthcare jobs. I've also seen people go, that is not really what I want to do anymore. Like, this is a reevaluation of my life. And maybe working in a tough school where there were fights every day was really triggering to my nervous system. So I'm going to make a change. So it sounds like you really miss it and you want to go back. And that's where I would think working with a team, I think it takes a team, but at least one person, OT, I think would be fabulous, but PT as well, to get you the resources to get back to that if you love it and miss it. I think it's very possible. Very, very possible. Thank you for that, that great question. Advice for someone who cannot access treatment. Oh, yeah. This is like my life's mission, is to have more availability of therapists that can help, and provide more education and support for people like you that can't provide providers. So, come tomorrow, we're going to talk about some of the things that we're doing at Reactive to be able to support and help people, even when they can't, not everybody can come to California with us, holy cow. We want to be able to help and support more people. So we're going to talk about that tomorrow. Thank you so much. Thank you for being here, for all your great questions, for what you're doing too. So I will see you tomorrow in our master class, hopefully, and hopefully again in the near future too. So thanks so much and have a great night.